think we are, sir.
Good morning.
Morning.
I want to thank you all for being here. Let me begin by thanking County Judge Willie Willis, Ms. Crystal Moore, as well as Ms. Linda Cannon with the Health Department, Dr. Susan Jones, CEO of East Arkansas Family Health Center, Mr. Brown working his absence at Baptist Memorial Hospital. Also, we have on hand, in case of questions, Chief Dennis Brewer, Assistant Chief Rose with the West Memphis Fire Department, with Supervisor our EMS Services, Assistant Chief Langston with the West Memphis Police Department, which oversees our 911 services, Ms. Janice Coleman, who is our Director of Human Resources, and City Councilman Willis Monday and Ms. Helen Harris, and our City Medical Director, Dr. Hashman. And from the county is Buzz Spears, who directs our County Emergency Response Service. All of these individuals, their staff, and others are significant to this discussion. Anyone who has been turned into the news, as well as on social media, is aware of COVID-19, also known as the coronavirus. And during these last few days, 2 cases were announced in the city of Memphis, Tennessee. I am pleased to announce that there have been no reported cases of the coronavirus in West Memphis. Our purpose today is to reassure the citizens of West Memphis that we are monitoring what's going on in Memphis, across Arkansas, and across the country, and taking steps to protect the citizens of West Memphis. I have reached out to Mayor Strickland and Mayor Harris' office to explore the responsible ways to coordinate efforts regionally, and as the city, we are prepared to take the steps necessary to keep the citizens of West Memphis safe. We are nowhere close to needing to hit the panic button. That's not our purpose here today. But there are some things that those of us in city government are doing and that you should consider doing to mitigate the risk and keep our city safe. My staff has been in touch with some of our businesses, healthcare, nursing home facilities, child care, and educational facilities in our efforts. I am confident that those entities are taking the steps necessary to protect their patrons, residents, and users. But there have been some things widely publicized that all of us should be doing. For instance, limiting skin and contact in public places, sneezing into your elbow, and washing your hands frequently, and touching your face are the things that the CDC is saying that we can all do. Some of these steps that the city has taken to protect our 500 city employees include: I have instructed an outstanding custodial and cleaning staff members to go the extra mile to keep the surfaces of our work environment, doorknobs, and etc., sanitized throughout the workday. Also, I'm working with our City of West Memphis Director of Human Resources, Ms. Janet Coleman, by executive order to implement a sick day waiver for any members of your city family that is diagnosed by a physician and has to be quarantined. It's the responsible thing to do. I've instructed our communications team to redouble our efforts to keep our employees informed on any pertinent information as it relates to this virus. We have been putting out information to our employees throughout this process so that they can make informed and intelligent choices in their daily lives until we are through this episode. And quite frankly, there are excellent precautions to keep in place at all times. Now, at this time, I would like to call up County Judge Willie Willis as he discussed the county's effort in this as it relates to this virus. Next, we'll hear from Ms. Crystal Moore and Ms. Linda Cannon to talk about the health department's measures that they would take to make sure that we are safe here in the city of West Memphis and in the county of Queen.
Thank you, Mayor. I am Woody Willis, I'm the county judge, and I want to say this morning that I've been in constant contact with Baptist Treatment here locally. I've talked to the CEO, Mr. Brian Welton, numerous times about the procedures that they're taking to work with this particular virus. I'm blessed to look at the team that we have back here that's been assembled today and being a part of that. We do care about our communities, and we're working very, very hard, and we're working together to make sure that we're protecting our citizens in this county And with this team behind us, I think we can all say that we're very confident that we're going to be able to do a good job. But we've got several people that are wanting to speak after me, and I would like to have Bud Spears, our Office of Emergency Management, to come up here. And he represents the county, and I'd like for him to come up here and say a few words also. Thank you.
Good morning.
Good morning, sir. Get your name, please.
I'm Bud Spears with Crittenden County Emergency Management.
Thank you.
At this point in time, everyone in Crittenden County needs to be aware that there are 0 cases of COVID-19 in the county. As far as what the county's doing to prepare for if this should happen, if we should have any confirmed cases in Crittenden County, at this time we're working with all of our first responders, fire departments throughout the county, working diligently with the health department, Ms. Crystal Moore and her staff, taking direction from them. We've been in contact with all of our county schools. At this time, they are taking the proper precautions that the school needs to take on advice from the health department. I can't stress enough, hygiene and cleanliness, not touching your face, washing your hands, not shaking hands in public places, things like that. Just common sense things that we all need to be doing. If in fact we do have cases present themselves in Crittenden County, the county has what we call our pandemic plan. At a time when the judge and I see fit where we need to implement that plan, we will. But at this time, we have no reason to implement such plan. We're monitoring this on a daily basis with state and federal authorities, and at this time we're good. There are no confirmed cases in the state of Arkansas. I think, if I'm not mistaken, as of this morning, we've got 3 people in the state of Arkansas that are under investigation, but they are not in Crittenden County. Really, that's all I have at this time. If we have a need to address the public with anything other than this, we'll call another press conference.
I would call for Ms. Crystal Moore and Ms. Linda Cannon. Will you please come forward, please?
Good morning. My name is Crystal Moore, I'm the Administrator of Crittenden County Health Department. Just to give you a little background on the coronavirus. The first case of coronavirus disease in 2019 was reported outside of China on January the 13th. By January the 20th, the first human-to-human transmission was confirmed, along with the first case in the United States. The World Health Organization declared COVID-19 as a public health emergency of international concern on January the 30th. The World Health Organization website is the best place to find up-to-date numbers of cases or deaths in the world. The Center for Disease Control and Prevention website is the best place to find up-to-date information on cases and deaths in the United States. The virus is thought to spread mainly from person to person between people who have physical contact with one another within about 6 feet, and through respiratory droplets produced when an infected person coughs or sneezes within about 6 feet. I'll turn it over to Ms. Linda Cannon, which is the Communicable Disease Nurse Specialist for Arkansas Department of Health Northeast Region.
Okay, I'm Linda Cannon with the Arkansas Department of Health. I'm the Communicable Disease Nurse Specialist. I'm repeating some of the things other people are saying, but right now, the state of Arkansas has no cases. We have 103 travelers that have recently traveled from countries of concern that we are monitoring. They are spoken to daily by phone, ask about any illness they may have, any symptoms, and we have 3 people who have been tested and they're under investigation right now. They're kept in quarantine for 14 days and watched very closely. Anyone who has returned from a country of concern, they're asked to self-quarantine at home for those 14 days. We're working with clinics, hospitals, nursing homes, EMS, and others regarding isolation and ways to protect themselves from getting this disease. The laboratory is able to test the COVID-19 along with national laboratories. We do have the testing kits available, and they're adequate to meet the demands that are needed for the state of Arkansas. Arkansas Department of Health has a call center to answer questions from 8 to 4:30 Monday through Friday, and it's posted on our website, www.healthyarkansas.gov. It is 1-800-803-7847. After hours and weekends for urgent calls, it's 501-661-2136.
Next, we'll be hearing from our city's medical director, Dr. Hashim.
Thank you, Mr. Mayor. Good morning. I'm Dr. Hashmi. I'm the city medical director here at West Memphis. A few things I would like to clarify here. Mr. Busby said we don't have any reported cases in Crittenden County. Let's be careful here. We don't have reported cases because we're not testing. Okay, so the exact science is evolving. Coronavirus, it originated from China, as we all know by now. But now it's a pandemic, so that's the reality we are facing. And nothing to panic about it. It's just like any other viruses. We have had coronaviruses in the past, but different strain. COVID-19, and now another strain of it has been discovered, which is spreading throughout the world. Italy is in quarantine, and there's a difference between quarantine and isolation. Quarantine is when you suspect some cohort of people that you want to separate them from the normal ones. Isolation is once it's diagnosed by proper testing. So as more test kits are available nationwide, I'm sure we will have our own share of coronavirus patients, COVID-19. But it's better be safe and wrong rather than unsafe and wrong. So as the mayor pointed out in the beginning, take all the precautions. Washing hands is very important, and at least 1 foot distance from whenever you're communicating with someone who might be sick. And wearing the mask and all that is a little overdoing it because it's affecting only the geriatric population. If you look at all the mortality worldwide, it's all 65 plus, immunocompromised. So the basic focus here at Crittenden County should be our assisted living and the nursing home. So we need to take some measures to make sure the entrance to those elderly population is kind of restricted. And that would be our best defense going forward. But if you remember the Spanish flu, 1918 to 25, 50 million people died. I remember Hong Kong flu. I was little, but I remember 68,000 people died in the US. So pandemics, you never know. Nothing to panic. It's just like flu, as our president said. We had 38,000 people died of influenza last year. So nothing to panic about. But all the precautions, because we don't know. We don't have the exact science. It's more virulent, apparently. Most people will get it. It will be just like minor flu-like illness. So 2 to 14 days is the period. If you have those symptoms, try to not be around at least the elderly folks. Other than that, we don't have any vaccination. We don't have any treatment. So even the people who end up developing pneumonia and ARDS, actually I was talking to a friend of mine. He is professor of infectious disease at Mayo Clinic. The best hospital, no doubt, in our country. They are prepared, but he wants us to be realistic, okay? There is no treatment, there is no vaccination, so prevention, as the mayor kind of mentioned in the beginning. So we are doing our part, but if any of you family members, especially the elderly ones, they are the ones should be focused. No kid has died, no children under 15 are of any kind of significant risk, but the immunization should be happening in the coming months, and treatment I would say probably a year away. So prevention. Thank you.
Next, we'll be hearing from East Arkansas Family Health Center CEO, Dr. Susan Ward-Jones.
Thank you, Mayor. I'm Dr. Susan Ward-Jones, CEO of East Arkansas Family Health Center here in West Memphis. We actually have 11 sites dispersed throughout the Delta. And just to piggyback on Dr. Hashmi and those other things that have been said, I think the best thing that we can do in this coronavirus is to make sure that we do good hand washing techniques, the things that we talked about, washing your hands for at least 20 seconds, also making sure that when you cough into your elbow, and just all those general precaution things that we should be doing anyway. I will say, as far as our health center is concerned, we're probably one of the largest outpatient centers in the city, and we've developed our own coronavirus kind of plan for our health center and all of our sites dispersed throughout the Delta. We have fully updated our staff. We had sort of a town hall meeting with all of our staff on last week. So we're prepared to take care of the population. We're getting tested equipment in as well. We're working with the local health department and state officials as well. So I think that, while we are concerned about this, we have to remember there's still flu season, and all the things that we're doing will mitigate the transmission of flu as well. We've seen, quite a few flu cases, and just diagnosed a couple this morning before we came here. And then also we had our first suspected case, but didn't meet clinical criteria for even testing for coronavirus, and make sure that, we're testing for flu, strep, and some of the most common other things that we'll see. So East Arkansas is fully equipped and part of the local efforts to make sure that we are educated about this and make sure we get appropriate testing. So thank you.
I would like to add one thing. There's a travel advisory from the federal government to the countries that are kind of epicenter of the disease. But what about travel to Washington State, New York, California? We don't know these answers. So just use common sense, and as I said, prevention is better, as Susan was trying to emphasize. But there are lots of questions that are yet to be answered.
We also have here our staff, Chief Brewer, Chief Rose, as well as Chief Langston, as well as the Director of our Human Resource Department, Ms. Jenny Coleman, on the city plan. But right now, what we can do, we'll open it up for questions. If you have any questions right now for that.
Can you tell us, Mayor, or any of you, how Southland Casino is addressing the coronavirus outbreak? A lot of people are concerned about that, and if it's still, there are any risks there?
You want me to take a shot? Well, I'm not sure about what they are doing about it. It's a private business, so we need to ask them. But what I would suggest, they should have, just like what the airports should be doing, and in Italy and other countries, they are doing it. They're screening people who are entering those crowded spaces for temperature. Anyone with temperature 100.5 or higher should be, encouraged to have further evaluation before they come. Because it only takes one patient to infect all of them inside.
You addressed the elderly being most at risk. Have you guys already been in contact with assisted living facilities for things and extra precautions that are going to be put in place at the entrance for visitors, family members, staff, and so forth? Can you talk about that?
Sure. My staff is working and reaching out to all of our facilities to make sure that they are doing everything properly. Even our schools, they just had a meeting just yesterday to address some of the issues and concerns, to make sure that everyone's being safe during this time. So we definitely reaching out to everyone from our schools as well as our senior living facilities to make sure that everyone is safe, and just taking the proper precautions to make sure washing hands and simple things like that to make sure that everyone is safe. Spears.
Also, we've got to keep in mind that our assisted living facilities are also, along with our schools and other facilities, are taking direction from the state health department. So they are implementing plans as they get information. Just keep that in mind, and like Dr. Hashmi said, there are a lot of unanswered questions right now. So we're kind of doing this on the fly, implementing change on a daily basis. Thank you.
I think the nursing home medical directors should be part of this, your team. Because if you look at all the mortalities in Washington, there was just one nursing home, 11 folks. So I think our focus should be what is the targeted population. It's already geriatric nursing homes. So I think medical directors of the nursing homes must be part of these dialogues and at the forefront of this.
I will say that Southland is developing a plan, an enhanced plan, but increasing hand sanitizers and wipe down some of the machines, and we're working with Southland to make sure a more robust plan is being developed.
And just to clarify, you guys said that there are no cases in Crittenden County. The 3 people they're just being quarantined, or can you clarify that?
That's suspicion based on travel
They're
history
just-
and other things.
Yeah, they're just suspects based on their travel. They came from a country of,
High
suspicion,
impact. And none of those are in Crittenden County.
yeah. No.
Okay, thank you.
Would any of you know how like the local jails are addressing this?
I do know the Arkansas Department of Health has been in contact with all these entities, and there are directives on our website that tells them what they need to be screening for and what they need to do to help cut down the transmission if it happens to occur.
Is there anything that the citizens of West Memphis, is there anything that they will see differently when they're visiting like a municipal building? Is there gonna be some obvious changes?
Sure, we are making sure we're taking all the precautions, make sure we got sanitizers, wipes, we even embracing the fist bump to an extent. So we're doing everything that's gonna be, to make sure we're being very cautious to this, virus.
Are the neighboring towns such as Marion and Proctorsville and Errol and all those places are reporting to you all regarding this?
I'm going to be reaching out to all our county mayors as well, as this will not be the only meeting that we're gonna have. We're gonna meet at least once a month just to stay on top of where we at with this, virus, just make sure everyone is informed, that we make sure that we put out the proper information that they need to make sure their citizens are safe as well.
What would you say to people, because the media's getting a lot of criticism in how we're covering this, and people saying you guys are making a big deal about nothing. What would you say to people who think this is not a big deal, that this is all overblown?
For me, I would say, I'll let you add it down. For me, I would say you can never be too cautious. Everyone wanna be safe, we just wanna make sure that everyone is doing what it takes to be safe. So, making sure they're informed, being very transparent with the people of our county as well as our city. We just wanna make sure everyone's safe, so if something does happen, we'll know the necessary steps that we can take to move forward.
I've got a question for the healthcare folks possibly, and it might have been talked about. Is there any benefit if a person hasn't had the flu shot? Is there any benefit for getting?
Flu shot is recommended, that is based on science, okay? It gives you antibodies against viruses that are out there. But the flu vaccination is specific to influenza, A and B, okay? Not to coronavirus or anything, so it does not give you protection against that. If that answers your question. But it is recommended.
Chief Roy, Chief Rose, and Chief Langston, if you all want to speak on the city doing the case of an issue may happen, corona case, sterilizing and different things of that sort.
Chief Dennis Brewer, we basically use the same process that we always use, just always be protected. This is the common sense stuff, work, wash your hands. When the guys go in, they're almost covered anyway with their protective equipment, so they're pretty much safe. Just the same process we need to use for any other thing that the disease come off, we just basically use the same thing.
So on the police side, we handle the dispatch center, so we want to make sure that if someone calls in for a medical emergency, we're asking the right questions so we can relay that information to our medical personnel, our EMTs, and to our police officers to make sure they're taking the proper precautions.
If someone suspects that they have the coronavirus, should they just show up to their doctor's office or the ER, or should they call ahead, as we've been hearing some officials in other places say, call ahead so you're not risking everybody else?
That's impossible.
Yeah, for our plan, we're asking patients, as it happened this morning, to call ahead so we can be prepared. And we have 2 negative pressure rooms that we will place those folks in during the workup. So we prefer that you call ahead, but then if you come, then we've got appropriate protective wear at the front to make sure that we get the patients in and isolate them as soon as we can.
This is called pretest probability. Okay, then the pretest probability of coronavirus, there are a few questions we should ask. I think the hospital should do that because this is a pandemic now. Fever is important. Shortness of breath is important. The age group, 65 and plus. these are the risk of travel history to endemic areas. So these are the questions, if you can pre-screen them before they come to the ER, waiting rooms, or big outpatient facilities, I think it's a good idea. That's what we're doing in my office.
Can you talk about the process for testing? If someone comes in and they are tested, can the testing happen in Crittenden County, or is it like it is currently in Shelby County right now where it goes to the state lab who relays the results?
He's not here, the CEO of the Baptist Hospital, so I cannot answer that question. He's the one who's supposed to be here to answer that. But I think they have some processes in place. Mr. Lewis probably will, but I don't think we have kit to test those patients yet.
We don't.
Right. So let's be clear about it. We don't have cases because we are not testing. So I'm pretty sure it's here. It's like stopping here. You can't do that. Okay. But when the tests are going to be available, I have no idea. But I'll check with them and let you know sometimes later this evening. But yes, it has to be confirmed through CDC. We diagnosed 2 cases in Texas. I'm the regional medical director, so I go to Texas to some hospitals. We have sent those nasopharyngeal swabs to the CDC lab, but those patients had very high pre-test probability of having corona. They came from China, Chinese citizens, with all the symptoms of coronavirus. So I don't know how we're doing it, but Ryan Walton is not here, but I'll find out for you.
So to be clear, the testing kits are not available in Crittenden County currently?
That's exactly what I said.
Okay.
Right.
Did the city and the county have a pandemic plan already in place, or is this something that you sort of developed here in the last few days? Can you kind of clarify?
Crittenden County has had a pandemic plan in place since 2003. We make revisions to it on a yearly basis to make sure it's updated with the correct information and correct contacts, and we will continue to do that. So yes, to answer your question, we do have a pandemic plan. It's been in effect since 2003, and we will implement that plan as we see needed.
Any more questions?
Yes, Mr. Mayor. After this press conference, how do we, as citizens, get the information we need concerning what's being done and what we are to do?
Well, actually, we're gonna place the information through social media as well here at City Hall. Actually, we'll be giving out hand sanitizers and making sure all this information is available to you all as you need it. And like I said, this is not our last meeting, it's our first meeting, and we'll continue meeting, get more information, find out what we need to make sure that we can have it handy and make sure that the citizens of Westminster are safe and informed with transparency, and we'll talk about the issue.
Just to emphasize what the mayor said, we do have a local newspaper, and I know they're sharing as much information as they possibly can, but I think you agree that we live in a society today where social media is where it's at, and even myself as a county judge, I have a social media page, and I have constantly been sharing information about the coronavirus over the last several weeks, and making sure that the citizens are aware of what's going on. We've assembled this team here, and we're going to continue working together and making sure everybody understands what's going on and the help that we have here. A few minutes ago, somebody said something about the county jail. I do know that the sheriff right now has turned up the cleaning process in the jail, and they're cleaning a lot more than what they were before. And from the 911 dispatch from the county side, they're actually giving additional information to the first responders now. So if they get a call and somebody's sick and running a fever, one of the things that they're telling those first responders is that this individual has not traveled anywhere recently out of the country or to another state, because we're having to look now and focus on, did they travel to another state, because they could have picked up something from somewhere else. So they don't necessarily have to leave our country to potentially be infected. So the dispatch has stepped up, and they're doing a good job of sharing additional information that we normally wouldn't get, except for situations like this.
Just for clarification, I will say that we've received some testing kits from our reference lab, Quest. But currently now, there's no labs to really send these specimens because they're being inundated. There's only 2 private labs that you can send them to, and of course, if we suspect it, we work with the local health department and send it to our state lab for testing.
Any other questions? Well, in my closing, the coronavirus is something new for us, so we are coming together as a team to try to get ahead of it. We definitely want to be proactive and not reactive to this epidemic. So I brought all of these experts and officials together because the citizens of West Memphis need to be informed, need to make sure that they're safe, and we do all that we can do to be transparent to the people. I want to emphasize there is no, let me say once again, there is no reported case or diagnosis in West Memphis or Clinton County at this time. Finally, I urge our citizens to keep enjoying their daily lives with their families and friends and continue doing business as usual. Keep doing some of the things that you have been doing, but just keep this on your mind to be precaution and make sure you're safe, and just pay attention to the small things now to make sure that we all are safe and make sure that we can keep the coronavirus away from the Clinton County and the city of West Memphis. Thank you all for coming. God bless you.